I think over time, you do have to change your methods because you want to be better. Different bugs start to show up, like different problems start to occur.
Do research on processes of what works and what doesn't. And
if you're in medicine, you have to be able to adapt to changes. If you don't, you're going to be left behind.
You basically, your brain allowed you to experience an entire set of events that never happened. Which I think is just like, oh my god.
The brain is a crazy thing.
And no one's going to be able to afford veterinary care, right? Because the prices have to go up to support the salaries of the veterinarians. I mean, it's this vicious cycle. Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
Excuse me.
Okay.
Sneezy over here.
He's got us listed at Apple Podcast Reviews at 142 and Spotify at 371.
I feel like our Apple goal was 150 at one point.
No.
I don't remember.
Can someone fact check us?
I don't think so, but I will say it's crazy because we were at when 100 was the objective.
Yes. We got 40.
I don't think it was 150. Maybe it was 300. I don't know.
Now we just said 500 on Spotify.
Yes, I think that's the objective.
Let's just do that.
That's the goal.
Okay.
And then something will happen.
That's our metric. Okay. That's pretty awesome.
Yeah, that's a lot of reviews.
Dang.
We're very reviewable.
We are reviewable. That should be on a t-shirt.
It's a hashtag.
Okay, so follow us on social media. We have Instagram and TikTok. It's at the Veterinary Roundtable. And then we have a YouTube channel where you can watch all the video podcasts if you so wish. And it's called the Veterinary Roundtable, the channel. So very original.
Easy to find.
We're trying to do more content. It's just hard with our schedules. So
yeah.
If you don't have time to watch or listen to the podcast, we post snippets there. So
yeah, on our Instagram and TikTok.
Absolutely.
I'm Dr. Ashlyn Duckwell.
I'm Courtney Allen.
And I'm Dr. Emily King.
And you are listening to the Veterinary Roundtable. If you didn't get that by now, because we've already said it at least 5 times.
Yep. Here we are.
Okay, so like pits and peaks.
Yeah. I can go.
Okay.
I have mine ready.
You've got it ready.
Like ever.
I love that.
Okay, I love it.
So my peak is this past Monday was my husband's birthday. So I took the whole day off and we hung out together and had really good quality time. My pit is my brother. So he, that sounds bad. What my brother's going through right now. So he has been for months, he's been saying he wants a cat. And so he finally found one that spoke to him. So he went and looked at him and ended up saying, okay, I want this cat. Well, the Humane Society he was at said, you need to come back and get him in a few days because we have to neuter him and blah, blah, blah. And Zach's like, okay, whatever. And so he went to pick him up that day, later in the day, brought him home. He looked fine at the shelter. He was cleared to healthy. Everything else was fine. They said he was fully vaccinated, the whole shebang. Well, then I think a few days after he was home, Zach noticed that he was super sneezy and eyes are watering. He wasn't eating his food. He wasn't really using the litter box. And so he ended up bringing him in because he just was not doing well. So he came into the clinic and he had a really severe URI. His temp was 104 or something. Okay. And he was super skinny. And Duckwell was doing her exam and she's like, oh, let me look at his neuter incision to see if it's infected or anything like that. Well, she got to where the testicles were supposed to have been removed. And she was like, Courtney, I think there's 2 testicles. And I was like, what? And so Zach started panicking. And then she's like, do you want to feel just to make sure? And so
he's supposed to be neutered, right? Sometimes there's a swelling in the
scrotum, or scar tissue or something.
Yeah. So then I felt that there's definitely 2 testicles. So Zach was blown away. He was just so taken aback and mad and whatever. And then they sent us records finally because it took Zach 2 weeks to get the records.
Oh my gosh.
And he got the records. The cat had 1 RCP maybe. That's it. He's 2.
Oh my gosh.
They didn't do an FIV FELV test. They didn't give him rabies. They gave him B12 and pyrantel. And ringworm. Oh, they ringworm tested him.
They didn't neuter him.
Yeah. So they didn't. Yeah. So it's been a whole like thing. And so we started him. We just did conservative treatment to start. And so we did doxycycline and then Mirataz, and I gave him sub-Q fluids. His FIV, FELV test was negative, thankfully, because I started panicking a little bit because they hadn't tested him.
He's been sick and all of that,
And so that was negative. So we started him on those meds. It took him like 4 or 5 days on the meds. He's finally eating. And he's acting like a cat. He's playing. Zach sends me videos like every day. He's so excited.
Too. We gave him Convenia originally because he wasn't eating.
Yeah.
And then she's like, he's not doing well. She sent me a picture of his face like,
he did not look good.
All right, let's just do Doxy and just shove it down him because I think he needs Doxy.
Yeah, so we switched to that, and that seems to be helping. Well, after Bernie's the cat, so he starts feeling a little bit better. My brother has a ferret. Now the ferret is sick. And when exotics get sick, they usually like to die. And so now Mochi is sick and Bernie's feeling better. Like he's doing great. He's scarfing his food. He's playing like a normal cat. Well, now Mochi's sick. So Zach has them separated. So they're not just like reinfecting each other over and over. So the ferret's living in the bathroom. The cat's in his bedroom. And it's just like a whole, like, he was just so excited to get this cat. And then it like starts off horribly. But
that is so hard.
Like just when you're not expecting to spend, like he knew he was going to spend money on a cat, but like all up front and then the ferret and like it's just,
obviously has reservations about getting this cat neutered at that place now.
Yeah, because they said bring him back and we'll cover it. But he's like, I'm not bringing my cat back to you because what if he gets sick again? You guys don't seem like you know what you're doing. Yeah. And so I told him, I was like, tell them you'll neuter him at our clinic, but they have to cover it. Well, it's too expensive for them. So he has to take him to like a low cost place, which it is what it is. Yeah. But
so cat neuter. So hopefully it's
So hopefully it should be straightforward. Yeah. So now he's just a little on guard, but it's just a lot to have to deal with when you're that excited about getting other anal.
It really is. Jeez.
Yeah. But the cat's he's feeling better. Now it's just getting the ferret over the hump.
So did the ferret come in and see Limpert?
It did. Yeah. He's on Clavomox right now.
Oh my gosh.
I know.
Does he take the Clavomox?
He said it's actually harder to medicate Mochi than it is Bernie.
I bet.
Because Mochi just like keeps his jaw shut.
Yeah.
Can you imagine a little ferret?
No. I'm not doing it.
So he said it's more difficult to medicate him.
Oh my god.
But he's getting his meds in him. So
that's good.
Poor ferret.
I know.
Poor everybody.
Because I went over there to give Zach, because Zach wasn't home, so I took Bernie his new meds, the Doxy and the Mirataz, and I was in his room, and I texted Zach, and I'm like, Mochi's sneezing. And he's like, yeah, he has sneeze fits like every once in a while. It's normal. Well, then Zach called me that following Sunday and was like, he's sick. And he was just mad and frustrated.
That's so annoying.
Yeah. So it's just been a constant back and forth.
That is a serious pit.
Mm-hmm. I know.
Dang.
Yeah. It's enough for one sick animal, not multiple.
Yeah.
Okay. Prayers to Zach and his animals.
I know, yeah.
He's not going to get another animal for a long time.
Is hitting hard right now.
Yeah.
Yes.
Okay, my peak is on vacation. I did my first like audiobook. I was like, let's just give it a try, and loved it. Loved the book. Loved the whole like just putting it in my ears and not, I could doze off, whatever. And so, I'm really pumped because now I'm on the second book of the series. And
what book are you reading?
So it's the popular Court of Thorn and Roses.
Okay.
I've heard that's really good.
Akatar, or whatever they call it.
Okay.
I like fantasy, love story type stuff like that. I was a Twilight girl for sure. So I'm on the second book, and I'll just put it on driving here. I listen to it, doing the dishes, doing the mixed chores way better. It's fantastic. I'm so pumped.
Yeah.
And it's a book that I enjoy. So I'm listening, not like, oh, I have to do this real quick.
Right.
So,
That's cool.
Yeah.
Okay.
Pretty pumped. Recommend it.
Recommend it for all those people who don't like to read.
Yeah. Or just have never tried an audiobook.
Do it.
I can't get into audio. I love reading.
Yeah.
Well, like I'm a reader though.
Yeah.
Like I like sitting down with a physical book.
My eyes get tired and I fall asleep quickly, even if I like the book. So
yeah.
Anyway. So yeah. And then my pit is we're potty training. And I dreaded this day, but I'm not putting too much pressure on us or on her because I'm like, she's just over 2. Like there's no pressure.
Right.
She's not going to kindergarten yet.
Right.
But I wanted to try to have it at least somewhat set before the baby came. And so, but you can't do it too close to the baby. And then they regress when a baby comes. And so it's just like, So anyway, we tried it and it went.
Came and went.
I cleaned up a lot of human pee over the weekend.
Oh.
And she would like start dribbling, but then she would like tell us. And so we'd try to, run her to the potty. I'm like, hold it. And poor thing, she just got tossed around.
Yeah.
I don't know. Then she went on the potty yesterday when she woke up from a nap at daycare. So
That's good.
I think it's just a seed that's getting planted.
Yeah.
No pressure. I try to do positive reinforcement like a puppy. She's like a puppy. She'll sit on the potty. We think she's done. Then 5 minutes later, she's tinkling in her undies. And I'm like, oh my gosh. And I'm like, you get a treat. You went on the potty. And
No. It's just like,
Kids and puppies are literally the same.
Yeah.
Oh my God.
Like everything is the same.
It's so similar.
They put things in their
She'll
mouth.
do it. It'll be fine.
I know. I'm like, now that we tried it, I'm like, oh, it'll work out.
Mhm.
I'm actually more terrified to take away her nighttime passy because I think we're going to all lose sleep.
Yeah.
So I'm like, and she's going to the dentist today. So they're going to tell me I need to take it away. And I'm just going to be like, look,
You come
the
do
girl
it.
is addicted. She needs a passy break, like a smoke break. She goes and grabs it for 5 seconds. I'm like, you tell me what to do then.
Yeah.
Oh my gosh. I remember when Harrison was like, I don't remember. He was probably 2 or whenever we were trying to get rid of his passy. And we we were taking him to go see a movie. So we made this whole thing out of it.
Yeah.
Have I told the story already?
No.
We were making this whole thing out of it. And we were like, all right, this is what we're going to do. He was probably 3. He was probably older. We're like, let's for today, let's take him. We'll take him to a movie. And so we're going to go see Dinosaurs. I think we saw the movie Dinosaurs way back in the day. And we'll take him to McDonald's. And when we're at McDonald's, we'll just throw the passy away. And so,
cold turkey.
And like he'll throw it away and then it'll be like, and we're going to go to a movie and like we're going to make this whole thing. So that's what we did. We took him to McDonald's. We made him throw the passy away.
At McDonald's.
And then...
And
moved
that was
on,
it?
went to the movie. Well, I mean, it was really hard. He still struggled a little bit, but then it was fine. It didn't even faze him after that.
Nice.
I think eventually, like, they don't care that it's not there.
Yeah.
You know what I mean? And so
They cope.
we waited for a while. I remember people being like, oh, you got to, get him off the It's like, okay, whatever. And then the other boys just stopped using it.
Yeah.
Like probably around this age, whatever. And then they just didn't need it. They left it in their bed. They didn't look for it, kind of a thing.
Mhm.
I think that's how we ended up transitioning them is it was always in your bed. Like you didn't take it out of your bed then at that point. And then
That's how we are right now. We're at that phase. And even at school, it's super helpful because they don't give it to her now at nap time where she used to have it. So it's just like a slow whatever.
I always told myself I never see an adult with a passy.
Someone told me that everyone usually goes to kindergarten potty trained and it's fine.
Without a pacifier.
So I'm like, okay,
it'll be fine. Yep, exactly.
I've seen people that cut holes in the tops of all like the pacifiers.
Yeah.
Oh,
And then like leave them out still, but then the kid goes to put it and they're like, this isn't right.
Yeah.
And then they go move to the next one and then they're all like that and they're like, well,
Oh, that's interesting.
I've seen that.
Cut,
I've
like,
seen
little
the pacifier
holes.
fairy comes
Yeah.
where they like bury it in the dirt and then
leave a toy or that.
They give it to somebody.
Right.
I'm like, that's not gonna work. She's
Or you could just throw it in the trash like I did.
At McDonald's though.
at McDonald's. Yeah, don't throw the trash at your house.
No.
We'll go digging
That's
for it.
why. That's why we did it somewhere else because then it's like you can't go back and get
Yeah.
it.
Yeah.
Anyway.
Yeah.
My pit is that school's starting.
Yeah, I can't believe people are going to school already.
I don't know.
Yeah.
I was driving here and I was like, why do we have to feel like we're a bunch of sheep that are just doing what people tell us to do?
Because that is what we were doing.
Like nobody
Yeah.
likes going to school at the beginning of
Yeah.
August. Why do we all say it's okay to do it? I don't understand.
Yeah.
So at college and everything, everyone's
College, Johnny doesn't go back until the 17th.
College is
Okay.
a little later than
Yeah.
the schools like around here.
But like Noblesville started yesterday, Wednesday,
That's
Sure did.
wild.
because they're on that whole balanced calendar thing.
Yeah.
Which I don't know. I don't buy. Like,
Yeah.
I just think you should not go back to school. It's so hot. It's still summer.
Yeah,
Like, who wants?
It's literally July.
Yeah.
Like that's not even. Yeah.
that's crazy.
So that's my pit because I'm like, I don't understand how this came about. Why did we say this was okay? So, but there's one state, I don't know if it's Minnesota. I think it might be Minnesota where they voted to not send the kids back until after Labor Day.
Good for them.
And I'm like, yeah, that's
There you
the
go.
way it
Put
should
it to a
be.
vote.
Let them enjoy their summer, because once they're out of high school, adult life starts, and then you get no break.
And then you get no breaks. Right. Exactly. I'm like, I don't know. I'm not sure our population is that much smarter since we've done schooling this way.
What's the point? To make us smarter?
Yeah, I think that was the whole point, is that retention of information.
I didn't retain anything.
What?
And so
I'm just
okay, they also need to have a brain break. Like, that's literally a thing for processing and development.
Yeah.
Well, it's like puppies.
Fun.
You can't train them for more than 5 minutes. It's like kids. You can't study for more than an hour and act like you're learning anything.
Yeah, that's weird.
So anyway, there's that. And I can't remember my peak. I had one when I was on my way here, and now I don't remember.
We're going to lunch.
Maybe that's what it was. Yeah, I'm very excited about that. That is something that we've been trying to get done
for like a month.
Yeah. And so we're going today.
We're getting Korean
food.
We're going to vlog it.
Yep. So be on the lookout for some content in regards to our Korean experience.
I'm so excited to see everyone's. Have you had Korean food before?
Just a small amount, just from you.
Oh.
The kimchi stuff.
Oh, that's it?
That's it.
So you liked it though.
Yeah.
Yeah, because I brought you some and you liked it. That was years ago.
Yep.
I'm excited to see everyone's reaction.
We'll see what happens.
Okay.
All right. On to the next segment, which is Tales from the Trenches. This is where we want our listeners to send in their most ridiculous, funny, unhinged stories that we will then read on the podcast. You can send your stories to the Veterinary Roundtable at gmail.com.
And when we read them, it's our first time ever reading them.
That's correct.
We blind react to these.
We have not
prepare prior to.
Exactly. Right. All right. Hi, Veterinary Roundtable. I'm Addie from Avon, Indiana.
Ooh.
Woo! I'm a fellow Hoosier. That's awesome. I'm currently working as a veterinary tech assistant and will be studying animal sciences pre-vet at Purdue in the fall. Okay. Congratulations.
Nice.
I've been listening to your podcast for a couple months now as a way to gain insight into the veterinary world as someone who is just beginning her journey. I just wanted to say thank you for sharing your knowledge and stories. I love hearing all your thoughts on different veterinary subjects, even the tough ones. It's honestly has taught me a lot that I will take with me as I start my journey towards becoming a vet. I actually have a story about my first time seeing a cat neuter. Okay. Last August, I began interning at a vet hospital during my senior year of high school. I had only been there for a couple of weeks, so I was doing a lot of restocking and observing. On this particular day, one of the doctors, we'll call her Dr. F, who had recently retired before I was there, came back to help out and do a couple of appointments/surgeries, starting with a cat neuter. By this point, I had seen a couple of spays and neuters, but never on a cat, so I roughly knew the drill. It was a nice cat, so I got to hold him while they placed the IV and sedated as usual. Then Dr. F said I could be her assistant to help monitor while she did the procedure. I was nervous but excited that she trusted me, so I stood near the cat waiting to take him to the surgery suite. Before I even knew what was happening, she performed the neuter right there on the table in like 2 minutes.
Yep.
Just sliced him right open with her bare hands and put him on the counter right in front of me. I must have been standing there jaw dropped or something because one of the other techs came up to me laughing and said, "Yeah, she's a mix of the best of old school and new med." The cat recovered from surgery just fine and went home later that day. I gained a lot of respect for her that day. Haha. This story does bring up a question for me. Because medicine is always changing, how do veterinarians who have been in the field for a long time feel about changing methods that have always worked for them? Thank you again, Addie.
That sounds about right. That's how a cat neuter goes.
Yep.
Yeah, it is.
It takes longer to
tie it off and
sedated and
yeah, that's what we always joke about, is that it takes longer to get them ready than to actually do the procedure.
Yeah, and recover them.
Yeah.
Yep. Yeah, which is nice. I mean, it's nice to have a straightforward, low-risk procedure.
Oh, it really is.
Yeah.
I love seeing
You don't have to think about it.
It is.
Yeah. I think I favor dog neuters just because it's a little bit more like fun.
Yeah.
Cat neuters is like pretty mundane. Unless you accidentally it tears or you don't get that knot tight enough.
Yeah.
Yes. If the knot slips, I had that happen once and the pedicle was starting to go back in.
You have to leave.
You got to catch it because it'll go in the abdomen.
If it starts,
then it turns into a shit show. So
then it's an abdominal surgery.
Yes.
Now it just became an abdominal surgery. Yeah. Yeah. So I'm glad you got to see that. That was really cool.
Yeah. Nice.
What's your thoughts on her question about
medicine changing?
I also want clarification if it was truly her bare hands. Did she not wear any gloves?
I would say there are a lot of veterinarians who do cat neuters without gloves on.
I would think so.
And you know what? I
that's just, I don't want to touch that.
No, I don't know. It's probably just I'm sure it evolved that way because, to your point earlier about it being such a quick procedure and the use of supplies and people being very prudent about how they use supplies.
Yeah.
And so I would not, I'm sure my boss did it that way as well, where he'd clean his hands. He would one incision, pop the testicle out. It's a tissue knot with a hemostat. Boom. Tissue knot with the hemostat. Boom.
Yeah.
And you're moved on.
Yeah.
I did see actually quite a few with an older vet, horse neuters, castrations without gloves, now that I think about it. So.
And I think when we first opened the clinic, and Cloud would know if this is true or not, I feel like we did cat neuters without gloves. And then we had a clinician who had a whole string of post-surgical infections.
Oh.
And we could not. So it was always her patients. And we were like, what is going on?
Yeah.
And so then there was some type of bacteria on her hands. And then we ended up reformulating. This was probably right before Dudley came. I don't know if Dudley was involved in that or not, coming up with the plan for it. Then we reformulated how we did all the scrub technique and all of that. So that's back when we used the scrub things.
Yeah.
So we went to using the scrubbing that way instead of doing it a different way. Like we had all these things that we changed. It was really interesting.
Wow.
And frustrating, but very interesting.
Sounds like a big headache.
At first we thought, this is just luck of the draw.
Right.
And then the more we got to dig into it, and I asked for some other people's opinions, and Dr. Martin from MedVet was one of the people who weighed in on what he thought might be happening. And so because the surgical technique was okay, like everything that we looked at was all fine. It was just this one person in their hands. And so then, anyway, it was really fascinating.
Fascinating, yeah.
And once we did that, we no longer had she did not have any more trouble.
That's crazy.
That is crazy.
So, so I think that kind of, I guess, speaks to, are you willing to change your methods? I think over time you do have to change your methods because
you want to be better.
You want to be better. Different bugs start to show up, like different problems start to occur.
Do research on processes of what works and what doesn't. And I feel like that's happened so many times already. And I've only been out 6 years. So
I think you have if you're in medicine, you have to be able to adapt to changes. If you don't, you're going to be left behind.
Yep. Yeah. And I think there are, like, the way people think, I think sometimes that might not change, but the way they do things needs to change.
Sure.
I think over time. So anyway. Yeah.
Be willing to adapt.
Be willing to adapt. Yep.
Okay, so these are interesting trending topics. I thought the articles were interesting. The first one is Ohio lawmakers loosen telemedicine rule. So it's essentially a bill that just got signed by the governor and it goes into effect in September. And it's saying that you don't have to have the veterinary client-patient relationship established. You can do the telemedicine. And they did... So there's obviously pros and cons to this. There's people who are for it and against it. It appeared from the article that the people for it were welfare, like it just increases access to care. The people against it are the ones who are like, how is this going to be good medicine? I can't palpate. I can't listen. I can't, the patient's not talking to us. All of those other concerns. I did see that they originally said no, but then revised it because of antibiotic usage concerns, where the bill is now you can only do an antibiotic for up to 28 days. And then if it's not working or more is needed, then you have to have an in-person exam to try to protect that way. And then you can't do telemedicine for food animal.
Isn't that interesting?
I don't like it.
I think it's a money grab to some degree. Like I can see why people would think it's a money grab because now you can have potentially like an organization who is just going to offer care via telemedicine to clients, like to provide opportunities for visits. You know what I mean? Like telemedicine visits.
Yeah.
Are you really fixing the owner's problems?
No.
That's like the question. I just am
I
not.
don't see how.
I still
don't understand how telemedicine works in animals. I get it. I understand why people talk about it. I understand the whole access to care point.
Access to care, but is it good care?
I know. I just don't get how, because they don't talk to you.
Right.
Like you could miss a heart murmur. And what if you give them, you could miss so many that just freaks me out. It's not good medicine.
No.
There's no way it can be good medicine.
I could totally see for behavior, if you could actually see a behavior in person, via a video camera in someone's household is better than the patient in front of you in an exam room. Okay, sure.
Yep.
But if they're like, my dog's vomiting.
Right.
What are you going, anything related to body systems, right?
My dog's coughing.
Yeah, my dog's coughing. My dog's
panting too much. My dog's having labored breathing.
Yeah.
Drinking too much water. So what you're saying, okay, you're going to talk to them and explain the necessary need for them to be seen in person?
Yeah.
Well, that's wasting their money. I don't understand. I guess that's why I'm saying it's a money grab.
Yeah.
I must be missing something.
It doesn't seem like good medicine.
I don't understand it. I mean, even from a perspective of shelter medicine, it's what good, whose benefit are you doing? I don't know.
Because the owner's going to have to then turn around and come into a clinic and spend money again.
Where are they going to get the meds from? The clinic? They have to go to the clinic anyway.
Potentially, some of them.
Take your dog, because you can't call everything into a pharmacy.
Cerenia is only vet med.
Yeah.
Things like that. Or you're going to, if they don't want to come all the way to the clinic for whatever reason, you're going to pay to have it compounded and shipped to you?
Yeah, I don't know. I really don't know. And I'm like, there must be something I'm missing. Why can't I wrap my head around this?
I like that we're trying to increase access to care. I just don't think it's the right way, because it's not good care.
Yeah. I
do no harm.
I think there's too many negatives to truly. You could do harm.
Yeah, that's what I'm saying.
I don't know. I struggle as well.
Mm-hmm. I would like to be firsthand and see it. And just see what problems or if they're if the veterinarians who are using the telemedicine, are they saying we're only using it for this? Is it just every problem? Any owner can schedule telemedicine? Are there truly that many owners wanting to schedule telemedicine? Yes, they passed this law, but are owners choosing that over?
Maybe if you're in rural settings where you can't get to somebody for 2 hours.
That's what I'm is it there really that big of a need?
I was going to say, but then is it an emergency? Is that why you're I need telemedicine right now?
My dog's bleeding out.
2 hours
over the phone.
I don't know. I don't understand. I don't know how it's helpful.
That's why I want to see how much they're truly utilizing it.
And if you're not establishing, so you don't need
you don't need an in-person.
You don't need
to establish relationship.
So the telemedicine can establish the client-patient relationship.
Yep.
Yes.
Which then the whole point of that is to allow you to prescribe.
Yes. But you don't have to touch the dog.
It's so interesting.
I don't understand the actual patient.
That's insane.
It's like pediatrics in telemedicine. I don't understand that either.
I'm thinking
how is
of
holding
the
your
scenarios
kid
in which I've done telemedicine post-COVID, because I know COVID was a whole different world anyway. So I don't think that even counts when that was more happening.
Right.
But the times I've done it are literally, the one I can think of is that it was a geriatric cat and it needed food or something. And even in a food script, we will go, I don't know what we're allowed. I forget legally what you can prescribe for that. But we're okay, it's food. That's probably not going to do harm because the cat's, on it. But even then it got to the point where I was I haven't seen you or talked to you about your cat in, I honestly don't remember, over a year and a half. I'm I'm not comfortable just carrying on, even if it's just food. We need to reestablish, is this cat, because my purpose was, is this cat quality of life okay? Is it not? We need to talk about being its voice and, the welfare of the cat. Because then they also had other concerns, of course. And so we're talking through, is this the right decision even? So that's one instance I've done it. And then the other instance I remember, and this was years ago, there's a extremely aggressive St. Bernard that literally one time went after my face sitting down. It was terrifying. But this dog would have ear issues, and it's a St. Bernard and it's extremely aggressive. And we had just seen it for ears. So I was okay, can I do telemedicine to at least you lift it up, get as close as you can, and then I know roughly what it's looking like to start. And that's the only times really I'll do it nowadays.
Yeah.
And it's very, very specific scenarios for it, though.
But I don't feel like we have a lot of clients asking for it.
No, we don't.
No, we don't at all.
That's what I'm saying. Like in this play, is there a large need? Are people like just continuously asking for telemedicine? Like what was I don't understand.
I don't know.
Like, are they actually going to use it? Yes, they passed the bill, but like, is it actually going to be utilized?
I mean, it said it focused on the rural areas, but it's also, I don't know. I just think it's interesting timing with all the other stuff as well of trying to increase access to care, but doing it in a let's slip the corner, let's
put a Band-Aid on it.
Yeah.
Let's take the easy, lazy way and do it.
Yeah. And, I thought that the use for controlled drugs, like they took that away. Like you can't do it for controlled drugs. And I was like, okay, that's the one place I thought that this is actually helpful, so I don't have to see the dog every 30 days.
Like a DEA exam.
Oh, right. A DEA exam where you're like, you want to know the dog's still alive and that the owner isn't taking the drugs.
Exactly.
Right. So, so then it's like, okay, the dog's sitting there in front of me. Okay. Yeah, I know he's still alive. So yeah, you can refill it.
Well, I think about it for like our seizure patients. Bringing them into the clinic can induce seizures.
Like, right.
KP has a patient like that.
Yeah.
It
so it's like, I'm not saying for in perpetuity, but like, every 6 months, maybe you see the patient then.
Yeah.
Like where it's like, okay, so you spare the owner having to drag the animal in every 30 days.
Right.
And instead you see him every 6 months or something like that. Yeah. Like that seems more reasonable.
Or like a dog with heart issues. They walk into the clinic, their heart rate elevates. And
that's happened too.
Yeah.
Anyway. Okay.
Anyway,
I'd like to.
So I think in some we don't understand.
I'd like to know what other people's opinions are on that. Like if we're missing something, if we're just not considering some factor.
I just don't understand the perspective. This is what needs to happen.
Right. Yeah.
Next one.
All right. Nevada announces plans for first vet school. So they're looking to open a school in Nevada, which is exciting.
Yeah.
Because we want more vet schools open because then we'd produce more vets and then we wouldn't be in the position we're in right now. So not having access to care.
That's right.
Right. Exactly.
Love it.
Oh my God.
That's the sum of it, right?
It sounds like there's not, it's more of an idea right now for Nevada. Yeah. It sounds like, but it said.
It's a good thought to have.
There's 34 now, 34 vet schools.
Yes.
And so, yeah.
So it's exciting. Good job, Nevada.
Bring them out.
Yeah, don't stop. Keep going until you get you break ground.
The one there, it says 34. The other one that might be coming is Hawaii. Which,
I read that and I was like, oh, I might have to go help there.
We might need to go visit
Except not right now because I think they're going through some weather issues. I think there's tsunami, right?
There is, yeah.
Oh, is there really?
Mm-hmm.
I haven't watched the news in days. Okay, so there's a tsunami in Hawaii. Or the
has
warning.
Happened,
they were getting ready for
warning,
one,
and they talked about evacuation, and
But once everything's good, we'll come visit it.
Everybody's okay.
Yeah, that's scary.
So
Mother Nature is scary.
What do you guys think about the question they pose in here about the fact that they've added more schools, but part of the problem with the existing schools is they can't attract talent, like they can't attract faculty.
Oh.
So you're going to have all of these schools opening and not have enough faculty to serve the students. Like what's happening now. That's why Alex has to go to Colorado or he goes to Tennessee or he goes to wherever because they don't have an ophthalmologist.
Oh.
Yeah.
Do you know what I mean? Like, do you guys think that's going to be an issue?
Better incentives. I don't know.
Well, we talked about that in one episode. I don't remember what we were talking about necessarily.
We're talking like benefits and
like
all that stuff.
How schools, like people are working in private industry instead of going back to academia because they don't have the same pay. They don't have, and they have now these huge student loan payments. So then they have to go where they can make their payments back.
Yeah. Right. Yeah, I don't think the opening more is going to solve the problem if we can't even fix it when there's what we have open now.
Mm-hmm.
But I'm sure that's part of the plan of looking at the schedule to open up a new, like they're going to have better incentives or it's going to flop.
And then they also talked about the new debt ceiling for student loans, being $200,000 and that.
Oh, like the new loans that we just talked about.
Yeah. And that these students and the 10 that just opened, I guess, apparently have $200,000 as the average debt. Oh my gosh. I think it's going to be crazy. I don't know what to think.
Yeah.
That's a lot.
I don't know. I think people are trying to solve a problem in the wrong way.
Oh, so do I, Duckwall.
I think that was established a long time.
Oh my gosh, yeah.
As soon as we heard 3 letters and had a conversation about VPAs.
Yeah.
Yes. Oh my
We're
goodness.
trying to solve something in the wrong way.
It's not going to get solved.
It's really not. I don't know how it changes. I think it's very interesting.
It's gotten too out of hand.
Anyway,
Case collections.
okay. Mine's somewhat extensive, so bear with me. We have a dog, a golden doodle. She's 7 years old, female spayed. I saw her last July 2024 I saw her several times for basically progressive limping of the left front. The original insult was to the toenail of the digit 5 of the left front that my colleague saw and treated accordingly. And then it just never improved. Like the limp didn't improve and it was pretty extreme and in fact got worse. So last year we did a series of diagnostics where the x-ray of the digit started to show osteolysis, like a little bit of bone remodeling at the P3 only. And the nail bed itself was inflamed. And so we essentially did, long story short, then we did punch biopsies around the nail bed and submitted that. And it did come back as there was fungal growth. So we treated it. We didn't spend the finances towards like the definitive type of fungus. We just started fluconazole. So she was on it for months and probably closer to 8 weeks. And I stressed to the owner, we may still have to continue this long term because if you have bone remodeling already, that's a pretty intense fungal infection and it can get really bad. We lost follow-up care. I mean, she was doing well, according to owner, and I guess we had seen her several times after for other things, and she wasn't limping. And finances have been a discussion throughout all of this, and so we more or less moved on because she seemed fine. And we never retook x-rays, we never re-biopsied, nothing like that. Now, a year later, July 2025, she comes in for acute left forelimb lameness, barely toe touching on it. And at the exam, her same digit and same foot, everything was extremely swollen. And she was extremely painful to gentle touch of it. And this time I shaved all around and I didn't really see a lot of skin lesion or anything like that. So I'm like, well, we need to take an x-ray and see where we're at. The x-ray essentially showed now P2 and P3 completely like eaten away.
Oh, wow.
Like the bone is like barely any density there. And just getting the image, the poor thing was really uncomfortable. What was interesting is that then the metacarpal of the same paw, metacarpal 2, I had been saying 1, but it was 2, is now starting to show remodeling at the proximal part of the metacarpal.
Geez. Yeah.
I'm like, what in the heck? And then I saw that, and my colleague actually saw it too, and I went back and like palpated it when at that exam, and she wasn't as uncomfortable. She didn't really care. So I'm like, oh gosh, what is happening? No fever. We ended up doing chest x-rays because of, I forget the official disease name, where you have digit lysis, and then it's actually from a tumor in the lungs. She didn't have any lung tumor, nothing in her chest. Her chest looked fine. So we then said, okay, this is an isolated issue going on here. So I talked to Dad, and I was like, okay, first recommendation is you get an actual bone biopsy of this metacarpal that's now weird, and see, and then obviously at that time, do we bone biopsy the digit? But to do like what is that called?
Like a core, like a
core, yeah.
cut,
I was like, we probably end up referring anyway. So that's one option. The other option is, do you see how there's basically no bone here on your dog's toe? And she's really, like, at that day, she was just so painful.
Yeah, she had never been that painful.
Yeah. And I was like, we can amputate this digit and then submit the sample and then therefore somewhat assume it's the same issue going on with this other bone now. And then the other thing is we just restart fluconazole and not take her off of it for a very, very long time and try to hope that we can control her pain. So he opted, after seeing the x-rays, for option 2. And so we did a digit amputation of that 5. And to which I agreed. What was interesting the morning of surgery is that she was actually walking on it and not as painful. Like when I squeezed, she pulled back, but it wasn't like where she was like, don't touch me, like this hurts so bad. So I thought that was interesting. And she had only been on Rimadyl and gabapentin.
Yeah.
So I'm like, okay, well, we're still going to do this because you have like no bone. So we went forward with it. And when I finished up and went under anesthesia, or she was under anesthesia, I called Dad and I said, hey, I want to toss this out to you, but I want to get your approval. What if I try to use a bigger gauge needle and FNA the bone of the other one that's abnormal? I'm like, I wanted to get your approval because 1, there's risk. I'm putting it into the bone. But 2, I don't know if I'll get a good sample. So I actually submitted it to our lab under professional interest. So it was no charge to the owner because I was like, we don't do this that often. I don't know if I'll get a good sample.
Right.
There's risk involved for the dog. So he actually approved it. And I started off with doing an 18 gauge needle, but it didn't penetrate very well. So then I went down to a 20 gauge needle and that actually passed pretty easily. And I was like, this is interesting.
Through bone.
Well, I think, because what I did is we took her to x-ray and we used a 25 just as like a marker just to make sure I was going at the right spot. And then the first time around, I like twisted it and I was like, okay, it's not like I know where I'm at, but it's not super easy. And the second time around, it went in a little smoother. So I was like, that's interesting. But I got a sample. I got good samples. It did come back, which I'm waiting on the whole picture, whole information. It came back with macrophages and osteoclasts or blasts. So inflammation of the bone.
Yeah.
I was going to say, I always just like hate bone biopsies. Like, I just feel like they're so frustrating.
You have to hit the exact right spot where the problem is. Otherwise, it's a waste.
And I submitted it as a cytology. They didn't do staining. They're like, there's no obvious fungal. There's no obvious neoplastic cells. I'm like, oh. Which I didn't know what to expect. So whatever. But what I also did to submit the toe, because I'm looking at fungus infection and I'm looking at like histopathology, is split the toe. So I submitted P3 for fungal testing with the nail. And then I did 1 and 2 for histopath because I know 2 and 3 were really affected.
Right.
It was a whole thing. Because then I was like, am I submitting this correctly? So I was already okay. So here's where we get into the real world. Everyone, the listeners, buckle up.
I wasn't there, but she told me about it.
I was already stressed about how to submit this correctly because it's you one shot. You got you're taking one toe. Okay. Right. So I called 2 different labs that work together. We sent them to Texas. And I'm like, how do I submit this? So I made sure I submitted it correctly. We fill out the 2 forms, whatever. I go over it with my nurse and I'm like, submit it this way. And we went over it 1,000 times. So I'm already stressed about that. I hadn't done surgery in a while. I hadn't done a toe amp in a while. And I love it. I love doing toe amps. And the procedure went fine, but it was bleeding so bad. I forgot to use cautery. The tourniquet didn't work. So I'm like taking forever just because it's bleeding everywhere. I'm like, get a little stressed out about that. And then I had this idea to do the bone biopsy or the bone FNA, which, let's be honest, I hadn't done that before. And so I like binned it and made sure I did it right. And everyone could do it. You can do it. But I was like calling the owner and they're like, okay, yeah, we could do that. I already don't know what's going on with this dog. So I'm setting this up I was already somewhat stressed.
Yeah.
So then we go into x-ray and we take a picture so I can see where the angle I need to go. But the dog is in a different position than the original appointment. The paw's in a different position. I kid you not, as soon as my tech snapped that x-ray, I looked at it and I was like, holy shit, did I take off the wrong toe? Because even after surgery, there's like gas bubbles. Things don't look like she was bloody, whatever. And I'm like, the instantaneous stomach drop, the panic, the internal, I'm going to vomit, I'm going to pass out. There's no way. Like at first I was like, there's no way. Yeah. I knew what I was doing. There's no way. And then like all of a sudden I didn't know the dog's anatomy. And I was like, I was seriously, you guys.
It gets ahead of you so fast, doesn't it? When you start to,
It was a moment. It was like some evil spirit was just waiting to jump at this stress moment.
Mm-hmm.
And then I had Dr. Dudley come in to help me just place, how to do the needle FNA and get her thoughts. And I'm like, Dudley, I didn't amputate the wrong toe, right? Like, I'm like playing it off. She hesitated. And I'm like, please don't tell me I amputated the wrong toe. She goes, well, let's look. She grabs the textbook. And I'm like, what
is happening?
What is happening? This is not real. She looks like a little bit concerned. And I'm like, holy effing, like I'm imploding, you guys. And my tech was so nonchalant. She's like, let's just take an x-ray of it and then compare it. Like, do more of like a DP. And, I was like, that's a good idea. So I step out for 3 whole minutes, maybe 4. I thought I amputated this wrong toe. I kid you not. I was like beside myself. And then Dudley later said I held it together. And I was like, I don't know how, because once we confirmed, everyone listening, it was the right toe. What happened was the image was flipped and the patient was in a completely different position. So it gave this abnormal appearance. Mm-hmm. And we compared it to the x-rays. It all was fine. But I took the rest of the day to recover. I took my blood pressure in the doctor's office. And everyone, like a couple of people were like, are you okay? And I'm like, No.
I almost just lost my job.
Yeah. I legitimately was like, I just had the most level of stress I've had in years. And also I'm starving. Also I'm pregnant. And and by the way, as soon as I finished that toe ordeal, I couldn't go to decompress and eat and stuff because an emergency came in for me and the dog was dying. On a new client, new patient. I didn't know the history. They just bring it back to surgery and the dog's like, and they're like, this is for you, Duckwall. And I'm like, what? I legitimately just finished this toe ordeal.
Oh my gosh.
So everyone listening, I want you to know
that is
okay.
crazy. It is. I just am so like, every time that happens, like when you think something and then it ends up not being that, but those moments that when you're in that place, how quickly you start going down all the rabbit holes, right? Like, it's like, oh my God. And then you start thinking, what am I going to say? How am I going to explain this? Like, and it's like, you don't even know it's true. And like, you know what I mean? Like you're going like, how fast
I pictured his voice in my head, like screaming at me.
Yeah. Like, it's crazy.
All of it. It just spiraled quickly.
Oh man.
It was bad. I couldn't remember what side the ulna was on to confirm. I'm like, literally,
you end up, you panic and you cannot think straight.
Yes. And I think it's one of those stories where you're like, you hear in the back of your head, like, oh, that would suck. Or, oh, did you hear that someone did this? And you're like, I would never do that. And then you're like, and the other funny thing is before I'm cutting, we're prepping. I'm like, out loud, I said, it's the left front toe. It's this digit, correct? And everyone's like, yes. So it's like,
yeah,
I did it all right. In that moment of question or something.
They talk about that in people, like where people have that happen where the wrong leg gets amputated or this happens. Or this. I'm like, that's crazy.
I also wanted to speak to you for anyone listening, like, it's okay if you make a mistake. We would learn from it. But also make sure you just have grace with yourself. Go back through and remember what you did well and how you did it appropriately. So I started questioning myself the rest of the day and I was like mentally all over the place. So I tried to focus on.
And you actually did everything you were supposed to.
Yes.
And you still had, it wasn't
nothing
enough.
went wrong.
You didn't make
nothing
a mistake. Went wrong. But you basically, your brain allowed you to experience an entire set of events that never happened.
Yes.
Which I think is just like, oh my god.
The brain is a crazy thing.
Like, wow. Like you just experienced something that absolutely did not happen.
Yeah.
And then the rest of your day.
It was
so hard.
It was really, and then I sat at the end of the day at my computer and decompressed. And I was just like, looked at the x-ray one more time. And I was like, all right, I'm just going to let it lie. And then I tried to just focus on other things. And then thankfully I had my counseling appointment the next day because we walked through all of it. And she's like, you had a normal response to a traumatic thought.
Right.
It's okay. You didn't do anything wrong. It doesn't make you like a bad whatever, because then you feel stupid and embarrassed. And but anyway, you just take it in strides.
Take it in strides.
Sorry I wasn't there for you.
It's okay. It really was just like, I don't know. I don't know how to explain it. Looking back, it's like all foggy. Like it just all happens so fast.
Yeah. No, that's, yeah.
And then I went back to work yesterday and
you were able to, right.
Yeah. I was like, bring me that black cat. Let's do this.
See how resilient you were.
Thanks. It takes a lot of work to get there, though. So anyway, everyone have grace with yourself.
Don't beat yourself up too much.
Yeah.
Do you want me to do a case still, or do we want to move on?
Let's just move on.
Let's move on to listener inquiries because we've got a couple of them.
Yes, we do.
We have several. Let's do it.
So next segment is listener inquiries, and continue to use our text message feature for our podcast. You tap on the episode in your podcast provider of choice. Look at the top where it says send us an inquiry through a text message here. You text us. If you want to shout out on the podcast, you have to include your name. Otherwise, it comes through as anonymous and super fun. We also now we're taking voice message inquiries. So you can send voice memos to the Veterinary Roundtable at gmail.com. Speaking of, we have our first voice inquiry today.
This is so fun. Okay.
So I will pull it up and we have to play it.
Hopefully we do it right.
I know. I hope this works. Let's see. Okay. It's loading. It's starting. Okay. I think this.
Do you have it on speaker?
Hi, Veterinary Roundtable. This is Lou Flowers. I just wanted to say how much I enjoyed your episode with Lauren Cabrera. Like Dr. King said recently, she's such an incredible resource for anyone looking to start a nonprofit like I hope to. Also, thank you so much for answering all my questions on the Bravecto episode. My heart was pounding with excitement and nerves hearing your feedback. Even with my slightly convoluted phrasing, your advice was incredibly helpful and inspiring. I'm currently working toward launching a nonprofit focused on establishing permanent veterinary clinics in global communities with large stray populations as an alternative to the more common short-term outreach models. That said, I definitely plan to get involved in some of the programs you recommended along the way. Thanks to your encouragement, I finally reached out to Lauren about possible opportunities in Saipan. I'd been thinking about it for a while, but your support gave me the confidence to actually take that step. So I just wanted to say thank you again for everything you do. You've truly made a difference in my journey, and I'm sure in many others. Wishing you all the best.
Oh my gosh, that was so cool.
I did too. I was going to say I have chills.
Okay, that was really cool to hear.
That was from Lou Flowers. I don't know if she said, but wow.
That was so cool.
Wow, that was really cool.
Get it, girl. Damn.
And like awesome. Hearing her voice say it instead of like us reading it.
Yeah.
It makes it
really
more
powerful.
like, oh.
Yeah.
Wow.
She reached out to, that is so cool.
We're making connections.
Saipan.
Oh my gosh. We're going now. Okay.
Oh, thanks, Lou.
Thank you so much for taking the time to do that, Lou.
Yeah, we're having our listeners and guests make connections with each other.
That means so
and like
much.
we're involved, but not really. That's so cool.
Yes.
Okay, people, don't be afraid to share your voices, literally.
Because that was amazing.
That was fantastic.
Yeah,
I enjoyed that better than us reading it.
I did too.
All right, number 2.
I just wanted to make a quick comment on the last episode discussing the injectable Bravecto. Dr. Duckwall had an idea of trying to time the injection so the lessened efficacy coincides during the winter when there is decreased exposure to ticks. I recently went to a tick talk with a parasitologist who told us that ticks are only inactive if the temperature is below 34 degrees Fahrenheit. I live in Ohio where there are many days in the winter above 34, so with that new information, I recommend tick prevention all year round. We are definitely seeing an uptick of Lyme disease rapidly across our entire state, so it's just a matter of time before it reaches you guys. Using prevention all year round will definitely keep our pets as well as their owners. Thanks for all the education and awareness you provide to the public. Keep up the great work, Dr. April.
Thanks, Dr. April.
It's a good point. It's a great point.
It's a very
because
good
I feel
point.
like winters are just getting less and less intense.
Yeah. 34. 34. We don't get below 34 all the time.
Ticks are resilient little suckers.
Well, it's been really bad this year.
Yeah.
And think of all the water, like with the moisture and everything. I think it breeds like the wet environment because it never got really dry.
The humidity and
True.
And so I think, that's another reason it gets really bad.
So then the question becomes, though, how do you, if you do the Bravecto quantum, how do you then substitute those, 4 months that are lapsed for the one tick?
I think there's going to be a lot of issues with it, especially from a pricing standpoint as well.
Mm.
It's going to be really pricey.
Yep.
So I don't know. It'll be interesting. I don't know what people are going to do. Or, like we were saying kind of on the last episode, I could totally see it for infestations.
I think that's what I was going to say. Maybe that's where you use it and then...
where it's like, we've got to get this under control and you're going to spend just as much money doing this way. Let's do it this way and you don't have to think about it anymore.
Yeah.
And rather than as a wellness model.
Sure.
But I also see people using it for wellness care. I don't know. I think it's going to have
It's going to be trial and error.
But
just like everything else is.
Yeah.
People are going to freak out, though. Let the social media gang go crazy on Bravecto for a while. Bravecto, because that's what's going to happen, right?
Yep.
Okay.
Sure is.
Thank you for that information.
Yes.
Okay, next one. Hi, VRT. My name is Elise, and I wanted to say thank you for such a great breakdown of what is happening in this field. This episode was fascinating. I work as a pharmacy technician at a small GP clinic in New England, and we have a new vet grad who is only 26, graduated in 2024, and is always talking about his student loans. I was absolutely appalled when he said they were $3,000 a month. I thought this was unusually high. He did go to school on an island, so I thought that was why. But it sounds like this is truly where it is all headed and what new grads are dealing with across the board. As someone who joined the field later in life with a non-vet med degree, this has me wondering what the future will be like for veterinary medicine. I love what you guys do each week and can't wait to keep listening. From Elise.
Thanks.
Yeah, that is, I don't know.
We rack our brains and we have no solution right now. Maybe one day.
The three of us aren't going to solve the world problem.
No.
No, we try.
We try really freaking hard.
We try to spread the
but
word.
that is the norm. You're going to see more and more of that, unfortunately.
And inflation and everything is just going to go up
There's
and up
gonna be
and
a
up and up.
breaking point. There's going to be a time where
Let's hope
something
so.
breaks.
Let's hope so.
But I don't know if it's a good thing.
Well, yeah.
Okay. All right. Starting vet school in 2 weeks. Woo woo! Okay, that's pretty exciting. In terms of the BBB effects and loan amounts, the financial aid team is trying their hardest to keep up to date on what will happen to us, but a lot is still up in the air. We will be grandfathered in for graduation plus until 2028. I'll be OOS and even getting the cost of living at bare minimum. I'll be taking out $97,000 for year one. but can get residency after 1 year. It's definitely been scary and taking away from the excitement of year one with big changes looming and the unknown.
Yeah, no kidding.
Wow.
That makes me want to vomit a little bit.
Wow.
That was my total for 4 years.
Wow. And you did not graduate that long ago.
No, that was only 6 years ago.
Yeah, I just think, wow.
Holy crap.
That's stupid. Nobody's going to... You know what's going to be the problem? We're going to not have any more vets, and we're going to be facing an even shortage than we are right now with access to care because no one's going to be able to afford vet school.
Well, and then no one's going to be able to afford veterinary care, right? Because
exactly,
we've talked about this
before.
Up. Because the prices have to go up to support the salaries of the veterinarians. Yes. It's this vicious cycle.
Nothing's ever going to improve at the rate we're at right now.
I could have been on board for these schools that aren't the distributive model that aren't going to have the hospitals associated with them.
Sure.
If their tuition would have been half
reflected that.
Right?
Yeah.
And they're all private schools, so that's why they can't be. So I understand there's a whole nother component side of it. I'm just talking without knowing all the information. But could you have a school that is half the cost?
Right.
I
Probably.
feel like this all just got messed up when the government stepped in and said, okay, we're going to cover student loans because now the schools just can charge whatever they want.
I know.
That is
just insane.
That is absolutely ridiculous. There's no need for that.
It makes me very scared for the industry.
Yeah. It's just ridiculous.
Ooh.
Okay,
last one.
Keep your head up. You can do it.
Oh, sorry.
Congrats
we didn't
on
mean to be a
starting.
downer. I guess we were kind of downing.
We just encouraged her taking away her excitement.
Oh, we did. We just contributed to that. Okay, wait, let's go back.
Yeah.
Let's rewind. Okay, first of all, that is so amazing. You're going to be going to school in 2 weeks.
That's right.
And you've got to be excited.
New journey. You did it. You made it there.
Absolutely.
That was the hardest part.
Absolutely. Now just go, have a great time.
Make new friends.
Do the fun stuff.
Yeah.
Because you're paying for it.
Yep.
So do the fun stuff.
Yes.
Yeah, do the breakfast clubs too.
Yeah.
Don't study every waking moment.
Yes.
Some of my best friends are from vet school.
Go have a great
enjoy.
time. Go get involved.
That's right.
And learn and enjoy it.
Yep.
It's an experience. Think of it more that way than
Yep.
something to dread. Okay. Now we can go on.
Okay. Do you know of any non-veterinarians owning practices? I'm interested in owning a practice, have an MBA, but not a vet. My background is in research and have been to numerous clinics over the years as a pet parent. Also noting the elements I really like as a client. I am considering trying to get a part-time job in a clinic to better understand the daily operations. Any advice or thoughts? Thank you. Anonymous.
I don't personally.
Yes, of course you can have non-veterinarians owning practices.
Oh, yes, you can. I just don't know any
people in the field in your leadership team.
Yeah.
Yes.
Yeah. I mean,
I don't think you can just walk in with an MBA and say, I'm running this show.
No, but I would tell you that a person with an MBA probably does a lot better job running a practice than a veterinarian.
100%.
I mean, just because veterinarians don't know a lot of...
But I think leave like the medical questions to the medical people, whereas you handle the business, like whatever all that is.
Yes.
Because we're not taught that.
Yes. And I think that makes a great combination.
Yep.
You have somebody who actually knows how to run the business side of and then as a veterinarian, you have those people deciding the medical decisions like you're talking about.
Yeah.
Yes. And it's a perfect match.
Yeah.
Harrison, what's the name of the clinic that you did work for? We were just talking about it with Pet Desk, and those guys, they're not veterinarians, but they own the practice. What is it? Family Pet Health. Where are they located? Murfreesboro, Tennessee. You should check them out because it's two brothers, right, Harrison? One has an MBA, or do they both? Yeah, and they run that practice. Nice. And is one of the brothers a veterinarian? No, they're both just business people.
Think about it.
And they have a great practice.
Yeah, I was going to say, think about people who own daycares, but they're not a teacher. That's okay. You hire teachers. Own restaurants, but they're not a chef.
I think it's great that you're considering taking the time to see the backside. You're going to see a lot. Let me just warn you, a ton of dysfunction. And so I think it's really great. Go into a practice and just be like, hey, can I work here part-time? People that are qualified are really needed in veterinary clinics. Yeah. And I think if you come in with like open ears and just don't try and change everything when you go in there and work, but be a fly on the wall and listen and then bring your ideas to people and then see how those ideas affect the practice so that when you go and want to own a practice, then you'd be like, okay, yeah, that didn't work, but I loved when we did this.
Yeah.
I think it's fantastic.
Yeah, just going in with having no idea of how vet med works, I think that would be a little
sketchy.
Iffy. Yeah.
Yeah. But I think easily you could own, and I think states vary based on like whether you're allowed to own a clinic as a veterinarian or not.
Oh, I didn't know
so
that.
I think that law changes depending on the state.
Okay.
So
you can own anything you want.
Almost.
And on that note, we got to get to lunch. So
thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
Bye-bye.